Hello, I am Dr.Jhansi. I am a pediatric dentist. I am here today to talk on oral habits. So, the very first question comes here is what are exactly oral habits mean? Yeah, oral habits are something which are performed very repetitively by kid or a child, and sometimes they even go unconscious and automatic. When I say unconscious or automatic, the child himself or herself doesn't even get to know that they are performing that sort of act they are doing. And unconscious is like, for example, when we are sleeping, that is a kind of where the state of unconsciousness we are in, but still the baby or the child performs the habit during sleep. That's where I say oral habits are which are repetitive in its nature, and which goes unconscious and easy to perform by kid. And the second question is like, are these oral habits are similar to general habits? Yeah, I would say it's not partially yes for this, because the basic funda behind performing any habit lies the same. That means when I ask a child or anyone to perform the act which they like to do, they feel very happy and satisfied. So the same way, when child or kid performs oral habit or something like putting thumb inside the mouth or some, they feel satisfied. The gratification is being completed for them, and in some cases they even allay their fears by doing that. Yes, so it's not completely yes, but yeah, basic funda remains the same. Now the third thing is, are they considered normal? It's not completely true. Till certain period of age like 2 to 4 years, yes, they are considered normal, but the habit persists even after they are no more considered to be normal. So now the question arises, why they are called normal till 2 to 4 years? It's like we being human beings and adults, we use our mouth as a primary source or the permanent source of expression. So we can talk when we feel hunger or some, but it's not the same with kid. So they cannot no more, they can't be able to say that they are hungry or something. So what the child do, they keep their thumb inside the mouth or any other digit and they start sucking. So that's where the mother understand my baby is hungry, I have to feed or some. So till the baby is able to talk or perform normal activities, these oral habits are considered normal. So now what are most commonly performed or seen oral habits in children? The very most common thing firstly comes thumb sucking, where the child tries to put his thumb or any other digit in oral cavity, they start sucking. The reason for this behind is like usually nowadays we get to see all working mothers. So the entire day the baby cannot be fed by mother. Only at nights they try to feed as much as possible, so the child feels like they feel completed. But they have to understand that the entire day the child is not exposed to mother's affection or the gratification what they feel by fed by mother. So that's where this habit starts. This is one of the reason that considered. Whereas when it comes to second most common performed habit as I would say tongue thrusting. So this tongue thrusting is also said to be normal till 2 to 3 years of age, where the child tries to put tongue between the tooth all the time, especially during speech or having food. That's where they have little difficulty in pronouncing certain words. Then the third one is mouth breathing habit. Yes, it's all very well known fact that we all breathe through nose, but few people they try to breathe through mouth. Why this happens? The very first reason is like we would generally see cold, but cold does not persist so long so that the performance gets converted to an habit. But yes, there are other reasons like deviated nasal septum or enlarged adenoids which are there just next to tonsils. Because of them, the air passage has been little compromised, and the amount of air that is inhaled by the kid is not sufficient for them. So they shift to alternatives, then they start breathing through mouth. This is third most commonly seen oral habit. Then comes bruxism. Bruxism is nothing but grinding of teeth or clenching of the tooth, and this is seen very commonly during nights. And the reasons for this are like especially in children when they are trained or when they are learning motor skills, especially muscle control and all. So they try to hold the bladder during nights. So while holding the bladder, they try to control it by clenching their tooth. This is said one of the reason for this. So whenever you see kid grinding their teeth, take them to washroom, ask them to clear the bladder, empty the bladder. So that's why it helps. One reason. Second one is stomach infections, any worm infestations they have. And the third goes like child is of school going age, they are stress related issues also. Like commonly performed habits are like nail biting, lip biting, pencil chewing, etc. These are all learned habits. It's nothing psychological impact which is there inside to cause. What are the effects that we can see after by performing these oral habits? So effects are like first we talk about thumb sucking. So when child puts a thumb or any other digit in oral cavity, there is always continuous pressure from the thumb onto the palate. So that's where instead of being U-shaped palate, they'll have V-shaped palate. So they'll have constricted arches. This is one effect on the upper jaw, and there is a continuous pressure from this portion of the thumb on the lower jaw. So that what that do restricts the growth of the lower jaw and the inward inclination of the lower teeth. So this disturbs their profile. And then comes to second habit, it's tongue thrusting, where I said the tongue is always the tongue tries to push or child tries to put the tongue between the teeth. So that's where they have flayed and spaced teeth. Instead of being like this, the teeth will be flayed and they've been moved out a little. It is seen both in upper and the lower teeth. So this scenario is usually called as bimax proclination. Then comes third habit, mouth breathing. So here is one interesting fact that when we close our mouth, usually our tongue will take rest from our palate, not from the floor. But when you open your mouth, tongue will fall on the floor. No more rest on the palate. That's where there is an imbalance between the muscle forces which are happening. I mean to say, we have cheek outside, which is muscle constricted, and we have tongue inside. So these two, they exert the forces. Cheek exerts the inward forces and the tongue exerts outward forces. The teeth are kept in a neutral zone because of these two forces which have been equally applied from both the sides. When one force is no more acting on it, like when I said in mouth breathing, the tongue is falling in the floor of the mouth, there is no outward pressure from the tongue which is pushing the tooth to be there in a neutral position. Only the cheek which is exerting the pressures. That's where again we see constricted arches, narrow arches. So again the same cause, they have a proclined profile. The teeth are which are being little forwardly placed. When it comes to bruxism usually doesn't have any appearance issues, but the child usually complains of very severe pain at joints when they open their mouth, and they feel very tender. The muscles will get very tender. They may not, and sometimes they are unable to open the mouth at once when they get up once in the morning. So the effects of bruxism are not appearance, but it affects the function, causing the pain at jaws and unable to open mouth properly. And rest comes the learned habits, what I said, nail biting or lip biting or pencil biting. They don't exactly cause any deleterious effects on our oral, the dentition and the jaws. But yes, when the lip biting happens very vigorously, they may traumatize their lip. So now, how to stop these oral habits and the treatments which are available to stop or treat these oral habits. The very first thing, yes, I say there are treatments which are there to help the child to stop the habit. But along with this, there are two important issues that always helps a lot while treating these oral habits. The first one is the motivation that is there from the child, that they want to get rid of this habit completely. And the second factor which affects the treatment is like the frequency, duration, and the intensity, how well they're performing the habit. So these two factors matters a lot during the treatment, while treating any of the oral habits. So the treatments are like it is based on the child's situation, child condition will be opting. Very first thing, where the child, for example, the child is very much motivated that they want to get rid of this habit, but they are unable to. So we'll help the child. That means they're performing the habit unconsciously. So here we help the child by giving something called removable or fixed appliances. They have that's been fixed to our upper jaw on the tooth, and with a wire on palatal side, which is just back to our front tooth. So whenever child puts the tongue there, they feel some reminder that they shouldn't be keeping tongue there. Yes, so this is one type of treatment. And second type of treatments, when the child is not interested in getting out of their habit, and but the habit is deleteriously affecting the dentition and the jaws. Again, we go for this fixed appliances. So the funda behind how it works is like, when child tries to put his thumb or tongue forward, they have that obstruction there. So the purpose of what they are doing is not sorted. So that's where they a little feel uncomfortable, and they try to stop the habit by decreasing the frequency, and the intensity will get little decreased. That's how they get rid of the habit. When it comes to very small kid, where we may not explain them, and where we cannot ask them to wear fixed appliances, we have something called taping of the thumb, or capping of the thumb, or applying bitter solutions on the thumb, so that whenever child tries to put, they feel distasteful or uncomfortable, and they avoid the habit. And when they are performing very unconsciously at nights, we will ask the parent to give a very long sleeve dress, so that they know more comfortable in placing the thumb or any. And for the learned habits, it's just simple. They don't have any psychological impact behind. So just a counseling of the kid will help a lot. So, and they'll come out of the habit. Now I would like to suggest all the parents, whenever they see the child performing such kind of acts like oral habits, get them to pediatric dentist as soon as possible, so that we'll help the child or kid to stop the habit, and prevent the deleterious effects which are being with the deleterious effects which are applied on our dentition and the jaws. Thank you.